and where wellness is perfect. It's been a really challenging year for many of us, and no matter what you do or where your families are, this has been obviously a very unusual year, and we're trying to do these virtual meetings so that we stay connected, right? It's still, hopefully, it's not the same as being in person, but we hope that you're feeling some connection to our group and what we're doing. And if you are not familiar with Women for Wellness, I'll share a little bit just briefly. The Women for Wellness is a group of women who care about healthcare in our community and believe in the power of collective philanthropy. Our vision is to be known for passionately supporting the quality and availability of healthcare to all those served by St. Joseph Health Humboldt. And so this evening, we do have several speakers talking about nutrition and sleep that we're very excited about. We are recording this evening. If you're not as comfortable with that, you'll see a note there, and certainly you can have your video and audio off if you'd like. We're going to spotlight the speakers tonight, but the reason we're recording it is so we can share it with others. Not everybody could come tonight, but they may benefit from the information we're going to share and having this connection. And our steering committee, most of them are online here tonight, and we're all open to talking about what we've been up to in Women for Wellness. And Catherine's going to speak a little bit about that this unusual year that we've had. And so with that, I'd like to introduce one of our steering committee members and founding member of Women for Wellness, Catherine Wayne, up in Trinidad, and she's going to share a reflection with us this evening as well.
Thanks, Ginger. Hi, everybody. God, thanks for coming. This is a great group. I'm going to surprise my friends who are listening and start out by paraphrasing a Bible quote. And the reason I'm paraphrasing is because I found out there are 29 versions of the Bible in English, and none of them have anything written the same. So I quit going to Sunday school 54 years ago, and yet this Bible verse has always stayed with me. Probably the only one that has, other than, of course, John 3:16, but it's Matthew 25:40. And it says, "Truly I tell you, whatever you did for one of the least of my brethren, you did for me." The sisters, when they came to Humboldt 100 years ago, they lived this every day of their lives. They believed that everyone they tended and every life they saved glorified their God. Now, Women for Wellness has a wide variety of women in it. There are professional women, business owners, retired people, homemakers, mothers. There are women who have worked in healthcare their whole lives, and there are women who have spent their whole lives trying to stay away from hospitals. A lot of our members are practicing Catholics. Almost all of my friends that joined are pro-choice atheists, and we have many faiths in between those two. But when Roberta Luskin-Hawk, planning ahead as she always does, began to worry that in the event of a coronavirus surge, we would not have enough ventilators in Humboldt County for the people who needed them, she asked Women for Wellness to pledge their $88,000 to buy the ventilators for the hospital. So within 24 hours, this diverse group of women, many of whom are not even in Humboldt County full-time, virtually stood shoulder to shoulder with one voice unanimously and said yes, thereby continuing the tradition of the sisters of caring for the most vulnerable in our community. It doesn't matter whether you read that Bible verse in one of the 29 editions of the Bible that's out there, whether you call it the Golden Rule, or whether you believe that taking care of the needy among us is simply the right thing to do. I am proud to be part of an organization of fabulous women who are still carrying out the mission of the founding sisters. So please encourage your friends to join. As I say, we are a very inclusive group. We are not doing this because it's a Catholic hospital. Most of the women in our group give to many different organizations for many different reasons. Everybody who cares about Humboldt County should be a member of this group and help us continue those sisters, what those sisters wanted to do here in Humboldt County. Thank you.
Excellent. Thank you so much, Catherine, for sharing that. That's great. A couple other things that we wanted to share before we get to our speakers is a couple of items with regards to wellness. Oh. And feel free to mute yourself if you want to just listen in now. And that'd probably be this a good time for many of you to mute so that we can hear our speaker tonight. So get ready for that. But I want to just quickly share that a couple of things. So we are working on a membership directory. And so we have a little sample of that Becky can place up there on the screen for us so you can kind of see what that's going to look like. It can include a photo or not, and just a little bit of information about yourself, so you get to decide how much about you want to share. But we are collecting information for that directory that's just going to be shared with the membership. There you go, great, thank you. And you know, if you don't want your address or phone number on there, that's okay. Or if you want to include your email, we'll include that or not. So that'll be up to you. But we would love to have you share a little bit about, you know, who you are for our membership directory. And there's a form for that. It's like, so if you haven't seen that before, then we can get that information to you by email and include you in our membership directory. Becky, is there anything else on that you'd like to say?
Yes, actually, it will be emailed to you. And if you want your photo with it, it's a link to a Microsoft program that just comes to me. And then I put it into the directory. And like Ginger said, it will only have the information that you fill into the fields. So if you aren't comfortable having your business or your personal address, for example, that won't be included in there, and this will help me to see that. It will come as a link, and then the other part of this is that I was unable to get it to be able to upload your photo, so the photo will have to be sent to my email, and that's there on the form. So anyway, if anyone has any questions, feel free to reach out.
Excellent. Okay, great. We're working on that. So the next thing I'd just like to share is that the St. Joseph Hospital, Eureka, opened its doors 100 years ago. And on November 1st, 2020, there's a celebration of the 100-year in operation. And this is going to be a virtual event. It'll be Sunday, November 1st at 2 p.m. And you can log on to their Facebook page to join the live event. It should be a lot of fun and to commemorate the 100 years in operation, which is a huge achievement. And we're looking forward to that. So we hope that you can join us for November 1st for a virtual event, since we all have to social distance and have virtual events this year. And the other event I wanted to share is going to be November 14th, and that is the Rebel Memorial Benefit Ball. Unfortunately, we have to go virtual this year. So because of that, it's going to be a pajama party, is my understanding, a little bit different tone than the traditional formal ball. So you can dance at home, I guess, this time around, and it should be a lot of fun. There's going to be some entertainment, is my understanding, and should be a great laugh and something you can do from the privacy of your home this year. There should, I think, also be some live fundraisers at that event. And so there's some information up here. We'll also email you that information and hope you can join us for that. That is, I believe that's a Saturday, if I'm not mistaken. Saturday, November 14th at 6 p.m. And we'll get you the information on that as well. Is that a Microsoft Teams, Becky? Is that instead of Facebook Live?
Dresses were not like they were explained, so I can test my whole charge and got everything back and more.
Well,
This had 6,000 reviews, and people said.
Someone's talking. Someone's got their microphone on. We can hear you. So you may want to put on mute if you're in a conversation. So So I'm sorry, Becky, we're gonna have that as another virtual live event, and is that Facebook Live as well, or is that Microsoft?
No, different, but a link as people RSVP, a link directly to it will be
Okay.
sent so that you can sign up.
Okay, excellent. So we hope you can join for that as well. Should be a lot of fun. And so with that, I'm going to get ready here for our first speaker, Jennifer Messana-Eaton, who is a clinical dietitian with St. Joseph Hospital. Jennifer grew up in the North Carolina and Tennessee area and found her way to Eureka by attending Humboldt State University. She fell in love with the area and the people and graduated in 2006. And after working a number of jobs locally, including as a banker for U.S. Bank in Arcata, she returned to school for her graduate degree in nutritional science at Chico State. Jennifer completed her dietetic internship in Chico and worked at Mercy Hospital in Reading, Orchard Hospital in Orland, and Chico Unified School District. And 5 years ago, she completed her internship and passed the registration exam in Chico. And following this achievement, Jennifer and her husband returned to Humboldt to run her husband's family business, Stars Hamburgers, which has been in operation for nearly 30 years. And she also, in the past 5 years, has worked at St. Joseph Hospital's nutrition department as a clinical dietitian. And so it's my pleasure to introduce Jennifer Messana-Eaton, who's going to share some great information tonight with us about nutrition, and looking forward to her talk. So Jennifer, are you ready?
Yes, definitely.
All right, we're ready to spotlight you and pass the floor to you. And again, those of you that are not muted, if you could mute for now, that would be great, so that we can hear Jennifer's information and her presentation, and then we can have you unmute when she's complete and ask questions. However, I'm going to guess if there's a question that can't wait till she's done, if you want to interrupt, please look for an appropriate time to do that, if you're okay with that, Jennifer.
Yes, that'd be fine.
Okay, great. Thank you.
Yeah.
All right, great. Thank you and welcome.
Thank you. Thank you for having me. I appreciate the opportunity.
Yes, thank you for making the time. All right, well,
Yes.
you have the floor.
Okay, so how do I make myself the one on the screen here?
She's got you queued up. You're good.
Oh, okay. I just don't see myself.
But you can't, yeah, you might be in a little box, but we can see you.
There we go. Well, she gave a very great synopsis of my background, so I think I will just get started in the presentation. And let's see here. There we go. Oh, it's flashing. Is that showing for everybody?
Yes, you're good, Jennifer.
Okay. Well, I understood that the topic tonight was going to be nutrition, stress, and sleep. And I put together something I thought people might find interesting information. So we'll get started. I wanted to see, what does nutrition mean to you? We get so many visual and all types of information out there these days, telling us to try different diets, telling us to avoid certain foods. And it seems everywhere you look, there's a new diet to follow or a new food to avoid. As well, it seems everyone is a nutrition expert. However, what's important is lost in all this misinformation, and it's about your health, your mind, and body. Instead, we should focus on what feels good. And shouldn't nutrition be about what makes your body feel good? Most of the time, the questions people are trying to answer when they're looking for the latest nutrition advice is, what can I do to be healthy? Unfortunately, most of the time, the questions are answered with diets that are targeting you to lose weight, rather than focusing on ways to improve your overall health. Our country specifically equates weight with health. It is true that we see a lot more people struggling with their weight today, but health cannot be simply defined by weight. There are many forms of healthy as well as unhealthy. You can be overweight and still be healthy. As well, you can be thin and be unhealthy. So I think that brings us to figure out how to define what is healthy. How should we ultimately define that? Getting a wide variety of fruits and vegetables, whole grains, lean protein, and heart-healthy fats, teaching our kids what real food tastes like, showing them what a healthy diet looks like and what a healthy lifestyle looks like. More importantly, we need to lead them by example and show them a healthy relationship with food and your body. It encompasses all aspects of our lives: diet, exercise, and just living. And this is where I would like to introduce a book called Intuitive Eating. It's actually a new movement that's been going on for several years, intuitive and mindful eating, where we have a paradigm shift of how we look at food and how our relationship with food. There's 10 principles for this book. The first 5 are reject diet mentality, honor your hunger, make peace with food, challenge the food police, feel your fullness. And we know that nutrition plays an important role in a healthy lifestyle. In our society, sometimes there's too much emphasis on what we can or cannot eat in order to lose weight. Therefore, we would be healthy. There is a new approach to health and dieting, a way that we can look at our health as it relates to our mind, body, and emotions. If you don't feel good about yourself, it affects all aspects of your life. Intuitive eating, also known as mindful eating, is a non-diet approach to health and weight. And there are 10 principles, as I mentioned before, and each of these help to break down the concept and help to define the goals. First, we want to reject diet mentality. One of the biggest concepts in intuitive eating is rejecting the diet mentality. Dieting is a way to control the foods that we do and do not eat, as well as how much we are allowed to have. Most of the time, the foods we are not allowed to have are the ones that we binge on the most. Restriction leads to overeating. Dieting is an external way to control our weight, our nutrition, and many of our daily habits, as well as our activities. When dieting, usually there's more than one diet that we've tried. This leads to yo-yo dieting. And in the short term, we lose weight. But in the long term, we end up gaining more weight, end up at a higher set point. As well, it's one of the least healthy things you can do is to weight cycle. It's actually less healthy to weight cycle than it is to be at a slightly higher weight to begin with. While intuitive eating helps you learn to listen to your own body's internal signals of hungry and fullness, you realize what types of food you're actually craving and what your body needs. You learn to listen to your body's natural way of telling you what nutrition you need to make it work appropriately. When trying a non-diet approach, you still must watch out for pseudo-dieting, where you still rely on external factors to determine the what and how much of your eating you're doing. I liked the diagram up here at the top. It's a good example of the weight cycling we do when we diet, with restrictive diet. And on rejecting the diet mentality, there really is not a diet out there that should be done the long term, because when you're removing one whole food group, such as the keto diet or paleo, it's actually fairly unhealthy to remove a whole food group or to have excess amounts of other food groups. It can mess up the balance, and that's really what we're trying to do is create a balance for our body. So to reject the diet mentality, we would have to make peace with food. Part of intuitive eating means that we make peace with food by removing the good and bad food labels. We give ourselves permission to eat those forbidden foods. This removes the restriction, taking power away from that feeling of deprivation. The food police are there to remind us of the rules of all the diets that we've followed over the years. They are the negative thoughts that we have about what we're doing and an unhealthy way to think. We all know that we have food police in our heads. We must stop listening to them. As we've grown up, we've stopped listening to our internal hunger and fullness cues. We're all born with those. It's important that we reconnect with these signals. Children are born, and with these signals, we all are. Babies tell you when they're full. Children do as well when you are feeding them. There's a great book by Ellen Satter on feeding your family, and it's you choose the what and the where, and the child chooses if and how much, and they use their internal signals to tell you that they're full. Additionally, we need to remove distractions while we're eating, so that we can actually focus on the food and really taste it and feel full, instead of being distracted with eating on the run. Checking in with your senses to gauge how hungry you are, and then pausing during a meal and checking in to see how you feel. Are you full? Are you still hungry? Are you almost there? When we follow diets, we're following portions that are assigned or particular recommendations in terms of how much we're allowed to eat. We're not listening to our body to tell whether we're actually hungry or full at that time. This scale, this internal scale that we have, is a good place to start. Sorry, this scale. Empty at 0, and you're ravenous, you're starving. It's actually not a good place to eat and get to, because then you overeat. Obviously neutral, you're not full yet, but you're not really hungry either. You're kind of right there in that middle, and then, you know, you can get all the way to stuffed and sick. I think it's a good scale. Honoring your hunger. We need to recognize when you're hungry and feeding your body. You may believe you're doing this when you diet. However, you're following external rules that's telling you what and how much you can eat. Truly honoring your hunger encompasses recognizing your internal cues and recognizing when you're emotionally eating. Since we were children, we have been taught to ignore those cues, and instead we've relied on various external factors. It takes time to recognize your biological hunger and satiety signals again. There are no good or bad foods. Additionally, we have created a vicious cycle of negative thinking when it comes to eating. Food is often associated with feeling guilty, and we become our own food police. A professor of mine used to say, "Don't should on yourself," when she was discussing the negative mantras that we all carry around in our heads. There's enough of that coming from external factors. The next principles, 6 through 10, discovering your satisfaction factor, coping with your emotions without using food, respecting your body, exercise in terms of feeling your body and enjoying the movement rather than trying to burn off calories, honoring your health and with gentle nutrition. An important factor is that we reconnect with the enjoyment of food and sitting down and enjoying a meal. To truly enjoy a meal without the guilt or other emotional baggage that comes along for the ride. This is a journey. It's not a quick weight loss diet, and rediscovering a healthy relationship with food takes time. You need to learn to begin to recognize what emotional eating looks like for you. It will take time for you to learn not to use food as a coping mechanism for stress. You can then begin to cope with those emotions in another healthier way. Making food choices that are not about the good or bad means that you're making choices that honor your health and make you feel good. Recognizing the food that you're craving and giving yourself permission to eat it. Over time, this removes the stigma of eating something that's forbidden, removing the urge to overindulge. It really comes down to moderation, and one meal does not change your health or your weight. It is how you feed your body consistently that has the biggest effect, which would lead to respecting your body. It's important that we love our bodies. Respecting your body is learning to accept it as it is and as it is yours. Leaving the if I could justs be and recognizing there is no perfect body. It will take time for you to become comfortable with your body and then to love your body. Look at exercise in a new light. It is about moving your body in a way that feels good, not about burning enough calories so that you can indulge tonight. It is more than exercise and the right diet. It's more about weight. It's more than about weight. It's about being comfortable in your skin and enjoying moving. Feeling good emotionally and physically when you feed your body is also very important, and that's what intuitive and mindful eating break down into. Yeah. Okay, sorry, notes. So references, obviously, but the authors of Intuitive Eating. Where's my, okay. I might have gone a little fast.
That's excellent. No, I think the timing is great. I think what you're sharing is very helpful, Jennifer. So I muted a lot of folks. So in order for you guys to have any questions, you have to either put them in the chat or unmute your line and ask a question. So does anybody have any questions? Give it a moment here. Can someone read that for me? I can't see that. Let's see. What is the book called, and can we get it? That is a wonderful message. What is the book called, and can we get it at Amazon?
Yes, absolutely. Intuitive Eating. It's Ellen Tribole and I've got it right here. It's actually written in 1995. I know they have new versions now. There's a movement, and even Chico State, we had quite a few programs. One of them was Love Your Body Week. We tried to introduce mindful eating and intuitive eating to the student body. I was part of a counseling program called Fit You, where we had physical therapy students, sports education, doing counseling for the physical activity, and we would do, as dietitians, counseling for students, trying to teach and pass along the mindful eating approach, intuitive eating.
It's great. I think in a year like this year, you know, they say calling it the COVID-19 pounds, I guess, or something. A lot of folks are struggling this year and probably would be inclined to try to put themselves on a real restrictive diet. And what I'm hearing you say is that that is a little problematic. And so speaking to what you were talking about a little bit, so someone who is in that situation, rather than go on a real restrictive or big change diet, would be to maybe do replacement of more nutritious things and then being more mindful of their hunger versus their satiety. Is that?
I think it's
to
more,
get there over time.
Yes. The biggest step and the hardest thing to do is reject, like I was saying, was reject the diet mentality. But there's a lot to that. It's kind of going through counseling with yourself if you have a negative relationship with food. If you've always told yourself stop eating something because it's not good for you, or you've always been dieting. It took me a long time, and I'm not even all the way there. It's a challenge. But it's healthier mindset. not just healthier for your body, because you end up getting this negative mantra in your head of talking to yourself, I should never do that. I'm going to get big thighs, or I'm going to, and you don't like yourself. You always talk to yourself negatively. And all that does is just kind of keep bringing you down and making you negative. So in terms of, honestly, I would say get the book. I think it's less than $20 on Amazon, because it really does give you nice steps.
Okay, great. I have another question for you. So how important is it to prepare your meals in advance?
Being prepared so you don't get really hungry, I think it's really important. I try to do that myself, because if I don't prepare or take food with me, I have a few food allergies. If I don't take food with me, I end up getting ravenous and eating something that makes me feel ill, eating too much. So I find food prepping, or at least having a plan, really, really helpful.
Okay, great. How about, let's see. A second here. What do you think about diet and brain health? I hear a lot about gluten being bad for your brain and your brain health or dementia.
There is a lot of information, and there's not a lot of strong evidence, I guess you could say, behind those. I'll call them, well, what do you want to call them? That one particularly would be, there's no evidence behind on that one in terms of gluten having a negative effect on your brain. Honestly, gluten is bad for those who have an intolerance or an allergy or celiac disease. What is the issue, rather than it being gluten, is the type of foods people are eating. When people go on a gluten-free diet, they start feeling really good right afterwards. It's because they've been removing all those highly processed, highly sugared, they're made with all the crap food. They stop eating those fast foods. They stop eating the donuts. They stop eating the crap fast food, and they feel better. It's not the gluten. It's the type of food they were eating to begin with, typically. Brain health, honestly, eating a healthful diet, working on your whole body feeling better, you're going to think better. You're going to feel better.
Okay, great.
Great.
Great. Do you know if the book might be available in local bookstores?
It very possibly, but
Okay.
I know it's very easy to get on Amazon.
Okay.
And there's
And we have
sorry about, but that's a whole other topic. Sorry. But
It's okay. And I do know we need to move into our speaker on sleep. So if we don't get to everybody's questions tonight, Jennifer has offered to answer questions offline too, so we can work on that. Or you can join the chat tonight, and maybe when you're done here, you can answer more directly that the group can see.
Sure.
But how does this concept relate to diabetes, was a question.
That's a good question. Diabetes is tricky because you're monitoring your blood sugar. If it's somebody who is not requiring insulin, it's much easier to manage. You want to, first and foremost, you need to follow the rules for your blood sugars. That's the most important. But also taking into mind and concept the intuitive eating formula, you can still follow that. There wouldn't be a huge challenge to do it for diabetic unless you're insulin dependent, and then you just have to be really careful of not going low. But it actually could benefit a diabetic a lot, because maybe they could work through those things that are making them want to overindulge in those foods that are making them sick by too much sugar and things like that. Having a healthy relationship with food.
Great. Well, thank you so much for your time tonight and the energy that you've put into preparing a great presentation. This has been great, Jennifer, and really appreciate your expertise and what you've shared. It's given us new concepts and things to think about. I think this book is going to be great for those of us that may want to pursue this further. I see such a connection between our diet and what we consume and our overall well-being, and you're speaking to that, and I think it's going to tie in nicely to our conversation tonight on sleep as well. So thanks again for being here. I did see there's a question about the NOOM program. Maybe you can answer in the chat while Patty's speaking, and maybe a few other questions that might be coming in. And in the essence of time, we're going to move on to our next speaker, but thank you very much.
Thank you
For doing this. This is great. Great job. Thank you. All right. Excellent. Patty should be there with us now. And I'm going to cue her up. So as Patty shared about her presentation, Patty Scagliotti is our next speaker. In today's fast-paced world, achieving a good night's sleep has become a challenge, having become something of an indulgence. Sleep has fallen behind our priorities of work, social time, chores, and entertainment. Tonight, we will discuss the importance of sleep for our overall health. Am I still here? You guys can see me, right? Why?
You are.
Okay, good. I'm like, it seems like everything's frozen. Okay. Tonight we'll discuss the importance of sleep for our overall health, the increased difficulties of getting adequate rest every night, including the incidence of sleep disorders across our lifespan, and tips on improving the chances of achieving a good night's sleep. Our speaker this evening is Patty Scagliotti. Patty has been in the sleep field since 1993. She started working with our health system as a sleep technologist in 1995 and has been supporting the Sleep Disorders Center in Humboldt since 2016. Patty holds several credentials in sleep medicine, including a certification in clinical sleep health. Patty is passionate about sharing her knowledge and expertise in the sleep field and aiding patients to increase their overall health by improving the quality of their sleep. It's my pleasure to introduce Patty Scagliotti.
Hi, everyone. Thank you for inviting me to speak. It's a pleasure to be here tonight. And let's see how technology does. I'm going to try to upload my presentation. Do you see it?
Not yet.
Not yet.
We are waiting. Yeah, she has you spotlighted. So when you share your screen, which should be next to the leave button there.
Which I thought I had done. So let's go back over there.
And if you're unable to, Becky can also share it for you, and you can tell her when to advance.
Content.
There we go. Looks like you're coming. Go.
There
Let
we
me
go.
know.
Excellent.
All right.
So
Like your dream catcher.
the National Sleep Foundation celebrates Sleep Awareness Week every year in March, where we as a nation lose an hour of sleep during daylight saving times. And a few years ago, they had this topic. They selected sleep as important as diet and exercise, only easier. So the question we're going to try to answer today is it easier? So the objectives tonight, I'm going to talk a little bit about sleep in general and normal sleep. I'll go over a few of the most common sleep disorders, including sleep apnea, insomnia, and restless leg syndrome. I'll talk about the effect of aging in sleep, and then give you a few tips on sleep hygiene or good habits of sleep. So why do we sleep anyway? In reality, that question has not been fully answered. There is a lot of research going on and a lot more that needs to be going on. We do know that our body regulates sleep in the same way as it regulates eating, drinking, and breathing, which tends to suggest that sleep serves a critical role in our health, just as much as nutrition and hydration. So we don't often think about why we sleep, but most of us know that if we get good quality sleep, we do feel better during the day. We feel more alert, energetic, happier, better able to function following a good night's sleep. However, the fact remains that sleep make us feel better, and going without sleep, we know we feel worse. That only just kind of begins to explain the reason why sleep is necessary and important. It is a physiological drive, just like hunger, thirst, and the need to breathe. And we do know that when we do not get adequate sleep, we can become ill, and the quality of our life decreases. So we do all have an internal body clock that tells our body when it's time to sleep. It is in the brain, and it regulates our sleepiness and our feelings of alertness. They work in tandem with our exposure to light, with our body temperature and internal core body temperature, and some of the hormones that are secreted in our body. This internal body clock takes cues mainly from our exposure to daylight, but also from social cues, such as meal times. So for example, when we travel across time zones and we suffer jet lag, one of the recommendations is that you try to throw yourself into the social cues of that zone and try to avoid being off the clock, have meals at the times of your new time zone, and so on. And that decreases the likelihood that you will suffer from jet lag. So the exposure to light and the social cues are the ones that cue the body to release melatonin to make us feel sleepy, and serotonin and norepinephrine to help us be alert during the day. So as women, we're very wonderful and unique. We're also unique in our body clock. Men's clocks run towards the 24-hour cycle that we base our calendar on. And so they tend to be less tired during the evening. As women, our internal body clock is more likely to be shorter than the full 24-hour cycle, which makes it more likely that we will awaken earlier. And it can also increase our susceptibility to early waking sleep disturbances, such as insomnia. So how much sleep is normal sleep? This graph gives you an idea. The dark blue is the recommended hours of sleep throughout a lifespan. The turquoise color says indicates what may be appropriate. So looking at young adult towards older adult, you can see that we need about 7 to 9 hours of sleep. Some people in the sleep field, we call them long sleepers. As a norm, need 10 to 11. That's what their body regulates. And then we have those very envied or sometimes hated short sleepers that can sleep only 6 hours a night and feel totally refreshed and do absolutely well. So what happens when we don't sleep that amount of time that our bodies need? There is an actually a sleep debt is created. It would be the difference between the number of hours that we actually sleeping versus the number of hours that our body actually needs to sleep. So it's important to remember that the brain will always collect that sleep debt, and it will do so by either devaluing our wakeful time. So we're not fully alert, we're not as cognitively effective. And also the brain will catch up on, will seize any opportunity to catch up on sleep. So when we're quietly sitting and we start to doze off, that's a good sign that we haven't had enough sleep. And sometimes it will charge the high interest rate of turning into illness. We can become ill from lack of adequate sleep. And it's important to remember that it's cumulative. So, for example, if you miss 2 hours of sleep per night, you will have owed 14 hours in the whole week. And if you go for a whole month, you have a 56-hour sleep that you have accumulated. And when your sleep has accumulated sufficiently, you can become chronically sleep deprived. So let's talk about what are some signs that you may have a sleep problem. Well, you cannot get to sleep. You lay in bed and you toss and turn and you cannot get to sleep. Or you go to sleep without any issues, but then you wake up in the middle of the night and you cannot get back to sleep. You may be waking up too early in the morning. A big sign is that you cannot stay awake during the day. Or you can't get up in the morning. You hit that snooze alarm button several times before you're able to drag yourself out of bed. You do strange things while you sleep, or sometimes your sleep is disrupted because of a bed partner. So as I mentioned earlier, we're going to talk about the 3 most common sleep disorders: sleep apnea, insomnia, and restless leg syndrome. So sleep apnea, it's a potentially serious sleep disorder where we stop breathing repeatedly during the night, and it disrupts the quality of our sleep. Plus, it can have other negative effects such as high blood pressure and cardiac disease if it goes untreated for a long period of time. Apnea is a Greek word that actually means cessation of breathing. There are different types of sleep apnea, but the most common type is called obstructive sleep apnea. Your throat muscles relax intermittently when you sleep, and it blocks your airway. And the most noticeable sign of obstructive sleep apnea is snoring. Snoring, it's common, but it's not normal. And it's a symptom of sleep apnea. So here's a graph that shows you what happens when a patient suffers from obstructive sleep apnea. And I'm sorry, I'm trying to use my pointer here to point out to the fact this is a normal individual sleeping and breathing normally. And you can see the air go through the nose or the mouth and go in normally get into the body and go to the lungs, provide oxygenation. A patient or a person that has sleep apnea has a blockage in their airway that you can see right here. And it's either because the tongue falls back into the airway, or sometimes the soft palate is too soft, the uvula falls into the airway, or there are enlarged tonsils or adenoids that block the airway. Sometimes people will say, well, I have a deviated septum, that's why I have sleep apnea. And you can see that the blockage occurs way past the nasal area. Technically, if you had a deviated septum, you could still breathe through your mouth. So the blockage occurs in the back area of the throat. Here are some of the symptoms, both nighttime symptoms and daytime symptoms for obstructive sleep apnea, but we talked about snoring already. There will be what we call as excessive daytime sleepiness. Individuals can wake up with morning headaches. They can become easily irritable, suffer from heartburn, lack of ability to concentrate. It can lead to depression, memory loss, restless sleep, frequent nighttime urination. All right, so prevalence, and I think this is important because the most typical sleep apnea patient, it's male, middle-aged, overweight. But I have some bad news for us women. So this is a study that was done. A STOPAN is a questionnaire that can be completed that assesses the risk of obstructive sleep apnea. And they did a comparison, people that completed the survey and then had a sleep study to see how likely, if their survey indicated that they may have apnea, how what percentage of them actually did. So here we see males from the age of 18 to 30, 70+% of them that answer the questionnaire with a high risk at sleep apnea, whereas females were here really low in the 20s. As we get into the 31 to 45 age category, about under 70% of the male, almost 30% of the females. Well, look what happens when we get older. Regretfully, one of the other joys of menopause is that we become more susceptible to obstructive sleep apnea, females as well. How do we diagnose it? It's diagnosable by either having an in-lab study or a portable home test that measures your breathing when you sleep. Treatment. There are a few ways to treat it. The most common and most effective, it's called CPAP, which stands for continuous positive airway pressure. And you can see here my picture of the happy his and hers CPAP mask. Basically, it's a treatment that involves a blower that pushes air into your airway with enough pressure to push aside the obstruction that causes you to stop breathing. So you cannot see it on the picture, but there's a machine that's usually placed in the bedstand that it's connected, pushes the air through the hose into the mask. There is also mandibular advisement devices that can pull the jaw forward and open up that back area of the throat. And there are some lifestyle changes. Sleep apnea, it's connected to being overweight. So sometimes people can lose weight and make a difference. Sleep apnea sometimes is positional. People only suffer from it when they're sleeping on their backs. So wearing a device that forces you to sleep on your side might be something else that helps. Okay, talking about insomnia. It can be temporary or chronic. Transient insomnia is typically triggered by a stressful event in our lives. Loss of a loved one, illness of a loved one, our own illness, loss of a job, any kind of stress like that that can make it difficult for us to get a good quality of sleep or go to sleep because we're thinking about our problems. And the problem with temporary insomnia is that it can become chronic because we start having these negative associations with sleep and with bed. It can present, as I mentioned earlier, either with the inability to initiate sleep or with the inability to stay asleep. And sometimes it can take the form of waking up too early and being unable to go back to sleep. So it is twice as common as a sleep disorder in women as it is in men. It does affect all age groups, but it does increase with age as far as incidence. It is the most frequent health complaint after pain as we become older. How do we diagnose it? Not by a sleep study, because all we could do is confirm, yes, you cannot sleep, but it's done mainly by history. Completing a sleep diary, it's something that doctors sometimes ask patients to do in order to be able to diagnose it, keeping track of when you go to bed, how long you think it took you to fall asleep, how many awakenings you have, what was your final awakening, and so on. And there is technology that can be used. An actigraph is basically a watch you wear that measures movement and heart rate and can create a graph that shows when the individual is actually awake or asleep over a period of about a week and show a little bit more accurate picture sometimes than a sleep diary. How do we treat it? Well, we're all familiar with sleep aiding medications. The caveat about that is all of them are meant to be used only short term. So they're meant to help you create a better habit of going to sleep and not to be used over long term because they can create tolerance so that you have to continue to increase the dosage of the medication, and sometimes you have to change medications because they stop being effective altogether when you're using them to treat chronic sleep apnea. The best way to treat chronic insomnia. The best way to treat insomnia is to use different cognitive behavioral therapy methodology, stimulus control, progressive muscle relaxation, sleep restriction. It's one of the most difficult ones. And it's basically staying in bed only when you're asleep and getting up and out of the bed when you're unable to sleep, rather than stay in bed tossing and turning. Obviously using sleep hygiene recommendations and sometimes using biofeedback. Okay, restless legs, it's another common sleep disorder, and we call it a sleep disorder even though it happens when you wake up, when you're still awake, but it's interfering with our ability to go to sleep. And we call it RLS for short. It's a disorder where the individual experiences unpleasant sensations in the legs when they're lying down or relaxing in the evening. So it doesn't happen any earlier during the day typically, but it's just you're relaxing and getting ready to have a relaxing evening and go to sleep that this discomfort starts occurring. Patients describe it as a creepy or crawly sensation in the calves, and it can make it difficult to fall asleep. There is also a need to move the legs to relieve the discomfort, either by stretching, bending, rubbing them, tossing and turning in bed, or getting up and pacing the floor. And that moving or getting up usually gives some temporary relief to the symptoms. So this is just a graph of the different types of sensations that patients have described. The causes, it can be caused by not sufficient iron in the blood, or also known as anemia. There are certain medications that can cause it, some anti-nausea drugs, some antipsychotic drugs, some antidepressants that increase serotonin, and some older antihistamines. Regretfully, alcohol, nicotine, and caffeine have a negative effect and can cause restless leg syndrome. Pregnancy can be a trigger in some cases. The good news typically is that once the child is born, about 4 weeks after delivery, the symptoms go away. People that suffer from nerve damage or neuropathy can also develop RLS, as can people that are on hemodialysis or end-stage renal disease. This is another disorder that can only be diagnosed by history. So it is the patient's description of the symptoms when they see their doctor that can trigger the diagnosis. And so the description often determines that the diagnosis will be accurate. The treatment, if it's caused by anemia, obviously iron supplements, the avoidance of caffeine and alcohol and nicotine is recommended. And the symptoms can be relieved by massaging the legs or using hat pads. And there are a couple of medications that can be prescribed that have been shown to be successful in treating the symptoms of restless leg syndrome. So talking about the effect of sleep over aging, it's called the graph that I showed you earlier, showing the normal amount of hours of sleep needed. They really don't change when we get older. What changes is our ability to have the same quality of sleep as we age. The only difference is we do get a little bit less rapid eye movement sleep as we get older. But you can see here, mainly is a disruption where instead of having a nice solid 8 hours of sleep, we have more awakenings during the night. So As we age, we also become more sensitive to some hormonal changes, particularly in women, physiological conditions, and environmental conditions. So we are more sensitive to light, to noise, and to temperature. So all of those things can have a negative effect on our ability to maintain good quality sleep. This graph shows us a percentage of sleep efficiency and how it changes with age. Sleep efficiency, it's the measurement of how many hours do you sleep versus how many hours you spend in bed. So if we take a 10-year-old, it takes in 5 to 15 minutes to fall asleep, and they wake up probably when the mom wakes them up in the morning. So they spend 8 hours in bed and they were asleep 7.7 hours, giving them close to 100% sleep efficiency. And you can see how this changes throughout life to where until we get into the 40s, we're mostly into the 90 to 100% efficiency. And then as we become older, it starts dropping. The blue line, it's men, the yellow line, it's women. So overall, our ability to spend the time that we're in bed asleep decreases as we age. So mention, the continuous and consolidated sleep becomes an issue as we age. And medications can also cause sleep problems, and you tend to take medications as we cope with the issues of age. So what can we do to make our sleep better? Well, sleep hygiene are some of the tips we can utilize to improve our ability to have a good night's sleep. The first one is to have as much a regular schedule as possible, including weekends. Going to bed at the same time every night, waking up at the same time every morning. Maintaining a relaxing bedtime routine, whether it's a hot bath, massage, a meditation, reading a good book, just having a routine that sets the idea in your brain that it's time for bed right now. Limiting naps to no more than 1 a day. Naps are really good for our health. However, if we take them too late into the evening, it will affect our ability to sleep well that night. And also, we want to keep them shorter than 30 minutes, just enough to give us a nice pep and be able to be more alert and awake. But if we sleep more than 30 minutes, we start going into the deeper stages of sleep, and you have experienced that sensation of waking up sort of sleep drunk after a nap. That's because you've gotten into too deep a stage of sleep. Limiting fluids and not eating too much close to bedtime. Avoiding caffeine, nicotine, and alcohol close to bedtime, sometimes even after lunch, depending on what your sensitivity to those substances is. Exercise is great, but you do not want to do it close to bedtime. I mentioned that poor body temperature is one of the cues that the circadian rhythm uses. And when you exercise close to bedtime, you're increasing your core body temperature when it needs to decrease in order to be ready and feel sleepy. And also take the opportunity at least once a day to walk a few minutes outdoors to increase the light exposure, because that will tell the brain, okay, it's the middle of the day now, I should start feeling sleepy about 7 or 8 hours from now. And so that helps the internal. It's also important to have a sleep conducive environment. And so this is your bedroom, and you want to start changing how you think about it. So the recommendation is that you use the bedroom only for sleep and sex, so that your brain associates your bedroom with sleep. That means that you're cleaning out all the clutter out of your bedroom, getting rid of your electronics, any toys, any work. It's not your gym, it's not your office, it's not a playroom. I did mention ditching electronics, no TV in your bedroom. That's the recommendation. You want to keep it quiet, cool and dark. You can use aromatherapy, anything that will help with that bedtime ritual. You want to make your bed as comfortable as possible. And I mentioned the mattress. This is something that I'm at fault of, but remember, ladies, that the life of a mattress is about 10 to 20 years. So if your mattress is older than that, you might want to consider another way of increasing your quality of your sleep is swapping mattresses. And painting your room might be a good idea. There was a study in Great Britain where they studied people in different color bedrooms, and people that had a bedroom painted blue, yellow, or green slept about 7 hours or more per night versus people that had a brown, purple, or gray room that tended to sleep 6 or less hours per night. So in conclusion, we do experience more difficulties achieving peaceful sleep as women due to hormonal changes, child rearing responsibilities, just general life stress. And we do experience a higher incidence of insomnia and restless legs. And we become more susceptible to obstructive sleep apnea as we age. So it's only we that can take the necessary steps to resolve some of these issues and ensure that sleep becomes as important as diet, exercise, and yes, why not? Maybe even easier. So make sleep your foundation for good health. Thank you for your attention, and I'll be happy to answer questions if anyone has any.
Excellent job, Patty.
Thank
This
you.
is Yes, thank you so much for all that great information. This is Ginger again, and while we're waiting to see if anybody wants to unmute themselves or ask a question in the chat, I know we're a little over time. I thought I'd ask a question. You know, I notice my husband snoring more over time, and even he says I snore when I'm asleep at times. And so is that cause for, you know, getting a sleep study? Like what would be appropriate to determine, you know, should we get a sleep study at some point just to be, or should we be concerned?
Snoring per se, like I mentioned, is a sign, but it's not by itself. There is actually a sleep disorder called primary snoring, where people just snore and they don't have any other effects. But if you if you have snoring and excessive daytime sleepiness, meaning that you're sleeping sufficient at night, but you're still tired or sleepy during the day, that's a concern. So it'd be those two. And also if you have any other comorbidities such as hypertension, and especially if you take your blood pressure in the morning and it's higher than the rest of the day, that's a sign that you may suffer from obstructive sleep apnea, might want to get a sleep study.
Okay, good to know. And we also wear the Fitbit bands, you know, to bed, and it tracks your sleep. So, you know, obviously wakefulness at night is normal, is my understanding. But if we're not getting that REM or deep sleep, then that could be contributing, maybe.
It's the other way around. If you have obstructive sleep apnea, you're not going to get the right percentage of each sleep stage. So if you notice that, it's not a cause of it, but it's a consequence of it. I see another question about what do you think about reading on iPads versus books with the light on? You know, the blue light from our technology, I don't know what it's going to do long term. I know that it's very negative for our sleep. Using at least a blue lights filter, I would recommend, if that's your, I'm as guilty as everyone else of all these bad habits, I'm going to tell you.
Yes.
So I completely understand. I'm telling you what we ought to do. And I think as we start having issues with sleep, we ought to consider those choices more seriously. But really, I understand the iPad versus the actual in your hands book, but at least a blue filter, because it does have They're very bright lights that almost mimic the daylight, so they're sending the wrong signal to our brain as far as what time of the day it is.
Yes, I've heard that, and it's easier to be aware but not always practice it, since even if you're just reading a book, we like to look at those devices for sure.
Absolutely.
Yeah, I think trying to get electronics out of our bedrooms is probably a good idea, but hard to practice.
All right, another question. Can you make up your sleep deprivation hours? Yes, you can. And so, for example, when I talked about keeping a regular bedtime, it comes with a caveat. If you are, because of your obligations, shortening your amount of sleep to less than what you need during the week, it's okay to make up during the weekends and sleep in a little bit. I wouldn't overdo it. I would also try to not have too much of a difference. So like, let's say you wake up at 6 a.m. in the morning every morning. I wouldn't sleep until noon on the weekends, because that throws your body clock into disarray. But I would definitely sleep in. And I could give a whole other presentation about napping, because it's a science. Take naps when you can. Go to your car and take a short nap during your workday if you need to. Because that's the best way to make up for it.
Very good. Yes, new mothers, they tell you to nap, to get through, but I think it might be good at any age.
Yes, absolutely. Yeah, and I'm Hispanic of background, so we have napping down to a science. And
longer lunches, right? That's great. That's great. Well, great. Well, we should wrap up for the evening, speaking of sleep, so everyone can get their rest tonight. Thank you so much, Patty, for joining us and preparing this great information. It's always a great reminder. I know I listened to a book earlier this year called Why We Sleep, and I learned a number of things from that. So lots of great information out there as well. Oh, and Patty, let's see. Jennifer looked up Noom. Yes. Jennifer, did you have something you wanted to add about Noom? I know that is an app and program that folks are using, and doesn't sound like you were as familiar earlier, but anything you want to share about that?
I was just looking, although it's not a traditional diet, it still would be an external way of measuring how much and what you're eating. So it's not along the same lines as the book that I was discussing. It's not really a bad thing, but it's not a non-diet approach, put it that way.
Gotcha. It is more of a monitoring and type of approach. Mm-hmm. Yeah, I have heard a number of folks being very successful with Noom, because it does, I think, address different areas of lifestyle, and I have heard some good success, but it is sort of a trend right now. So we'll see in the long term how that works. Yeah. Mm-hmm.
There's a lot of
Ginger, I just wanted to show everyone the crackers before we go, once they're baked.
Okay. Excellent.
Okay, so if you can see, can you see mine look like?
A little bit. If Becky will, there you go, spotlight you.
Is it too dark? They look delicious. Yeah. Look at you.
Oh yeah. Those look great. I'm looking forward to
the beans. So the lemons are nice and cooked, and they're a little bit crunchy, nice and oily, delicious.
And so do you put the beans on the crackers? Is that an option, or you?
Yeah, I mash them with a fork a little bit and then put them on the crackers.
Excellent.
They're good with a little bit of feta. And just about anything. Feta for the rest of us. Yeah, feta. Right. Sorry. Just teasing. Rebecca, thank you so much for your cooking demo. It was perfect. Oh, it was fun. I'd love to do it again.
Well, great. Well, that concludes our evening, and we look forward to following up with all of you by email, the membership directory, and our upcoming events, St. Joseph Health and Redwood Memorial. celebrating 100 years in the annual benefit ball. And we also have an event on December 11th, will be our holiday social, looking like we're going to be virtual again or as well this year, but also looking forward to our major hope is that we'll be back to in-person events next year. I'm hopeful, and we'll see how the year progresses, but that's be best, I think, in the long run, and hope we get there soon. So anything else, Becky, you'd like to add? If not,
It's
we will.
Roberta. I just want to add my thanks to Patty and to Jennifer as well. Thank you so much for the presentations, and thanks to all of you who joined us.
Yes,
Thank you, everybody, for coming.
yes, thank you, everyone.
Yes,
We
thank you.
appreciate it.
Thank you, Ginger. And thank you,
You're
Becky.
welcome.
It was
Yes,
fun.
thank you.
That was great. Thank you, Rebecca. Thank
Have
you,
a good night,
Ginger.
everybody.
Have a good
All
night.
right.
Take care.
Bye.
Thank you.
Have a good night.